Good afternoon, everyone. This is Lloyd with AVS Medical. Thank you for taking some time out of your busy day to join us. We look forward to showing you how to use an online payment portal here in your Lytec software. I'm going to wait about 30 more seconds here as we've got some other folks that are jumping in the webinar. But once we do, we'll go ahead and get started right away. Okay, again, good afternoon. This is Lloyd. Let's go ahead and get things started. We really appreciate you taking time out of your busy day to join us for our first Lytec webinar of 2016. We do want to be respectful of your time, so we're going to go ahead and get started right away. And I think we will get it wrapped up here in about 30 minutes. So today's webinar is focused on optimizing patient payments using some new tools that are inside of your Lytec today. You may not be familiar with them, and we're going to show you how to use them in today's presentation. As I mentioned, I think looks like I know everybody on the line here. This is Lloyd, and I'm happy to have with me today Jim Ladwig. Jim is from a company called NextTrust, and NextTrust are the developers of the Bill Flash software that is built inside of your Lytec software. So before we get started, just a couple of housekeeping items here. If you want to minimize the control panel on your screen so you can see the full screen, you can click this little red arrow here at the very top of your GoToWebinar control panel. That will minimize it and get it out of your way. The other thing is that your phone lines are muted during the webinar, so you can't ask a question, you can only hear us. At the end, we'll go ahead and open up the phones, and we can unmute them one at a time. Or if you prefer, and this seems to work out pretty well, down towards the bottom, there's a little question section down there. You can click that and just type a question in. We'll see it on this end, and we'll answer that for you. Okay, so as I mentioned, today's webinar is going to introduce you to some new tools that are already in your Lytec that's going to allow you to quickly and easily get your job done, and will result in increasing the amount of collections from patients, as well as decreasing the amount of time it takes to get those payments collected. In just a few minutes, Jim is going to walk us through a live demonstration and show us how it actually works inside of your Lytec. And a moment ago, I mentioned that it's going to increase your patient collections. The reason I can say that is we have so many clients today that are using this, both in the Lytec software and also in its sister product called Medisoft. And they all report the same thing, that once they give patients the option to the ability to pay their bills online, they notice an immediate increase in payments and immediate decrease in the amount of time it takes patients to pay their bills. So Jim is going to show us that today. Before I turn it over to him, I've talked about really the focus of today's webinar is on that online payment portal. But Bill Flash does a couple of other things as well, and you can use all of these or any part of these. You don't have to use them all, and you can use any kind of combination of them that you'll want to, but I think it's worth just a couple seconds here to mention what they are. So in addition to the online bill pay, Bill Flash can automatically deliver paper statements. So instead of you printing, addressing, stamping, folding, all of that stuff, you click and upload a file to them, and within seconds, they will mail, or it takes just seconds to upload that file. Next day, they mail out the paper statements. The other thing they can do is they can also send those statements electronically as a secure email to your patients. Jim's going to show us the online payment portal. It's called ePay. And in addition to the online portion, you can also use that in the office, and that component is called Office Pay. The great thing about the payment application part of it is those payments are pulled right into your Lytec. You don't have to rekey those into your software. So that's just a little preamble to what we're going to do, or what Jim is going to show us. And Jim, I am going to go ahead and turn things over to you so you can take us through a live demonstration.
All right, thank you, Lloyd.
Make you the presenter.
Yeah, sounds good. Let me show my screen here. Can you see the Bill Flash logo there?
I see it now.
All right. Well, thanks again to Lloyd. We're certainly thankful to be a part of this and get to show you a little bit about what we've done with Bill Flash inside the Lytec software. As Lloyd said, we have a complete suite, and I'm just going to kind of take you through the process of checking in a patient, sending a statement, and then collecting payments. So what I'm going to do is I'm going to open right up to Lytec here. And what we've done in partnership with McKesson in the Lytec software is we've built in some pretty powerful things to help you streamline the processes. Here I'm in the Lytec scheduler, and I can see I have Sarah Lee here on as a patient coming in, and if she's checking in and I want to collect a copay, traditionally you may have a credit card machine that sits on your desk next to your check-in computer, but with Bill Flash we just make it much simpler. You can right-click or even just do the F6 function, or you can come down here to enter copay as prepayment. Now, for those of you who aren't familiar with prepayment, it's something that Lytec built in a few years back to solve the problem of being able to, enter copays when you traditionally before when you had to enter a copay, you had to have a charge generated. Well, with the prepaid function, you can actually take a copay before you have that charge generated. And then when you do generate that charge, you have that copay money already sitting there to be applied. So it's really slick, and we're certainly thankful that they built that in there for you. So let's just say I am taking a prepayment copay of $15 today, and I'm choosing my transaction code of a payment via credit card here. So let's just go ahead and do that. If you saw this button right here, Office Pay, lit up. And what's nice about this is all I need to do is click that button, and it's going to open up billflash.com, and it takes me right to our payment portal. Now what's happening in the background is Lytec is actively syncing with our site to take this patient payment. And when I'm done taking this payment of $15 here for Sarah Lee's account, which is all the information is right here, when I'm done taking that payment, we're going to see that we're going to get a confirmation number back in Lytec. So I have a credit card reader sitting on my desk here, and I just ran my credit card through that reader, and as you can see, Lytec refreshed in the background. I have my approval and my confirmation. I can print a receipt, or I can even email a receipt, which I have an email address if I wanted to email that, or I can edit it and put a different email address in there. So back in the background, my copay screen went away. I've already got that sitting now as a prepayment under Sarah Lee's account with a confirmation already attached to it. So super convenient way to just move patients through and collect those copays, and ideally streamlining your process that you're currently doing. Now, once we've gotten the insurance payments back, we want to collect a patient statement, right? We want to take care of our patient statements, get those sent out. Well, under billing, Lytec has built in a whole set of functions that are just for Bill Flash. So this is the statement processing button, and as you can see, we have all these things, and they are all Bill Flash buttons. So we can set up an account, enroll, go directly to our reports, or even view previously sent statements. This is great if you have a patient that's calling you on the phone and say Sarah Lee says, I'm ready to pay my statement, but can you tell me what line 4 means? And you just go here, view the exact statement that she's looking at. I can approve files if I've already transmitted them, or right here I can get things started by transmitting a batch. I choose the correct format, and we'll give you a full training. Getting this started, we have a full training package that comes with it. So I might move through these fairly quick, but keep in mind, we'll take you right through it, and we'll even help you send a test batch out. I got my qualifiers here. Before I transmit my statements fully, I can qualify if I wanted to include or exclude certain runs. I can a lot of things I can do here. Right now I have just my statement messages based on what I've set up in Lytec, and those will transfer right over. If I have email addresses, all that stuff, we're going to get it over at Bill Flash too. So real simple, I'm going to transmit these documents. Bill Flash sends them to a file and then uploads that file right to our site. And you're going to see it'll be so kind as to even open the web browser for us. Takes me right to a screen we call Approve Files. This is our Approve Files screen, and there we can see Centertown Offices is my Lytec database. There it is. There's the statement batch that I just uploaded, and I got 11 documents there ready for review. Now I can go in and I can review those statements. I can make edits. I can change things if I want to. It's very nice, very convenient. I'll just kind of show you a review screen briefly, but we're not going to spend too much time here. I can look at this screen. I have my aging, my build amount, messages, color, delivery method, all that right here. I can make edits. I can type directly on the statements. If you want to see more about that, definitely get with us over here at Bill Flash or Lloyd, and we can take you through that. But we're going to move on. So back in that approved file screen, the other options I have are to reject the batch or approve it. So when I approve this batch, it's going to be mailed out the next business day. So I get my confirm approval, and I can see how many I've uploaded, how many I've mailed. It would even tell me if I had to delete a few off if maybe I decided that those weren't ready to go out yet. If I sent a few out via e-bill, I could see those right here, and then my total. So I confirm my approval, and they get mailed out the next business day. Now, with our e-bill, I'm just going to show you briefly the formats of our statements. Here's our basic statement, black and white. We have a few color options: blue, green, red. Red is really popular if somebody's over, say, 60 or 90 days. Put it on a red one. It might get their attention a little bit. But as you can see, there's a link to our ePay, our online payment portal, My Provider link, and it gives us a document ID. This can also be accessed right here on your e-bill. This is what an e-bill looks like. It's very simple. There's no healthcare data, so we are fully HIPAA compliant system over here. We have these yellow boxes that you could customize with any kind of text that you'd like. And then we have our view and pay bill function. So this button would take you right to our site, My Provider Link. And at My Provider Link, just kind of take you there, you get two options. You could sign in as a new user, or you could set up an account. So I've already pre-populated a document ID and an account number. And here's the options that I'm going to be given. Make this bigger for you. Here's the options. I can create an account, or I can do a one-time payment. And I have my amount due, my patient name, everything. So if I want to create an account, I just put in my information, and I even get prompted to go paperless. Benefit to this is you guys are going to save money when you go paperless because we're cutting out the post. You don't have to pay for stamps. So it's going to cut down your cost of sending statements. So I could set up an account, or I could just do a one-time payment and keep it simple. I have here, this is a negative balance. Let's just say it was a positive balance of $10. And I have here a very easy to use payment portal. I can add messages to my provider if I needed to add a message here. I can do it on a credit card, or I can do it on a check, and I can just make my payment. So all I need to do is put in my checking account, routing number, and email address and confirm that, and then I make my payment. It'll give me an option to print a receipt. Now, the convenient thing about this for you as the biller is back in Lytec, we've built in a function to bring those payments back in without you having to go run a report and hand key them. So right here in the payments section, we have the apply patient payment, which I'm sure you've seen before. have this little sidebar over here that's for e-pay items, and I already have one here, Young, and all I got to do is click this button. If I have any more, it'll ask, and look, I have another one right there, a $79 payment. So I have all the information. I have my reference number and confirmation ID and everything. All I need to do at this point is click Next down here at the bottom right and apply that payment to the line item that I need to apply it to. There's my $79 application. So very simple, very convenient. This is going to help you avoid any key errors. It keeps it a lot more streamlined so that you can just move right through the process. Now another function is, let's just say somebody does call and they want to make a payment. Well, I can apply a payment right here. I have this Office Pay button. I can select a patient. I could do it that way and then click Office Pay and apply that payment. Or if I wanted to look at the charges and payment screen, when I select a patient, let's just say I select Sarah Lee again, we can see I have prepaid balances down here at the bottom right. But all I need to do is make a new payment here, and we're just going to adjust this transaction code to patient payment credit card, and we'll just make it say $10. And as you can see, I get an Office Pay button lit up at the bottom. This is going to do the same thing I showed you from the scheduler. You'll be able to open up a payment terminal right from Lytec. You can hand key that payment, you can swipe that card, and be on your way. So the nice thing about this is, let's just say you're on the phone. Instead of somebody telling you the check's in the mail, well, you can take that check right over the phone, and you don't have to wait for the mail. If you can take a credit card right over the phone. You don't have to wait for that credit card in the mail. So really streamlines the process and helps you just get more ways of collecting those patient payments and then streamlining that process right into your Lytec software. As I mentioned before, we do have reports, and our reports are very wonderful. They're very specific to healthcare. That's what we do here. I'll show you real quick. It's going to take you right to your delivery reports, and it'll show me the statements that I've sent. So here's my Centertown offices again. I've sent statements. They're going to be right on file. I can click that batch. I can see the statements. I can even view a print image of every statement that I sent. So very powerful, very relevant reporting. When I uploaded it, when I approved it, when they were mailed, and when they were e-billed. Under payment transactions, I can look at payment reports. This is great for reconciliation. If you wanted to print at the end of the day or at the end of the month and just show how many payments you ran through our system, you can do that. We'll just look at the last 30 days. And here are some payments that we've taken. I have my patient name, the account, the confirmation, the office location, whether it was a walk-in. This one was done here online. Nice thing about this one for Sammy that was done online, maybe I want to see what bill was Sammy looking at. Well, all I got to do is click, and there it is. There's that $71 statement we sent, and we know right where to apply that payment, or at least to confirm. So again, very powerful tools that are all built right into your Lytec. You may have seen these before. You may never knew they were there, but Bill Flash has worked very hard with McKesson to streamline the process and make it very easy for you to collect the patient payments and send the statements, as well as providing a great online payment portal that allows you to take payments 24/7. Real quick, just to wrap things up, I'll go over the pricing. I do have a Bill Flash pricing sheet here. Our introductory for opening up an account, your first 30 days are on us. We're going to give you free services for 30 days. We'll pay all your credit card processing fees, and we'll pay all your statement processing fees. So if you want to try our service out, you can do that for 30 days. There are no contracts. There are no obligations to continue after that 30 days. Once you get into the normal pricing, it'll be as follows. Our online e-bill. If you're sending an email notification, it does go free if you're already sending a paper statement. If you're sending an e-bill without a paper statement, it's only 25 cents. So if you're going to send a paper statement by itself, it's 26 cents plus the cost of a stamp, which right now is at 49. So that brings your total to 75 cents. So by having patients switch to e-bill, you're saving over 60% just by going to that 25 cents. So like I said, the professionally printed paper statements do come with a return envelope, the tear-off top coupon on the statement, and the e-bill attached to it as well, all for 75 cents. Additional pages are 17. Color is 1 penny. Our NCOA link, which is the National Change of Address Database, you'll get an update of the new address on file with the NCOA, and you'll also get that statement resent for only 50 cents. Over here, our payment services, we have our online e-pay. You can do the check transactions or you can do the credit card transactions. For credit card transactions are 2.86% with a 19-cent transaction fee. And then for online check transactions, they are only 39 cents down here listed below. There's no percentage for the check. Our in-office payment solution, qualified transactions, those are going to be swiped in-office transactions such as HSA, debit cards, basic credit cards. Those are 1.37% with a 19-cent transaction fee. And then non-qualified transactions are 2.86% with a 19-cent transaction fee. So our rates are extremely competitive. If you would like us to do a rate comparison, we'd be more than happy to help with that. I've mentioned here our transaction fee of 19 cents a few times, and as you can see over here in green text, we have a bundle credit. So if you put all of our services together, by doing our payment transactions, you get a 10-cent credit every time someone makes a payment. You'll get 10 cents off of your statements. So it's a great way to bundle things together and save some money. Our unlimited support training, we refer to this as our account fee, is $17.50. You only need one account to have multiple sub-accounts underneath that, so you only have one account fee. So if you're a billing service or you bill for multiple providers in the same office, you could have one bill flash account fee and multiple sub-accounts underneath that, but you're only paying the one account fee. And again, just to wrap things up, we do have our thank you gift, free services for 30 days. The only thing you'd be responsible during that 30 days is the cost of a stamp. So just 49 cents, and you can send as many statements as you'd like, collect as many payments as you'd like in that 30 days, and we'll take care of the bill. So moving on, Lloyd, I know you're going to open it up for some questions, or if there's anything else you'd like me to cover, I can do that now.
No, I think you did it all, Jim. Thank you. That was great. As Jim mentioned, that we can go ahead and if anyone has any questions, I'll be happy to unmute your phone line. There's a little hand icon there on your GoToWebinar control panel. If you click that, that signals to me that you'd like me to unmute your phone line. I can unmute your line. You can ask your question. Or, as I said at the outset, click that little questions section down at the bottom and type your question in, and we can answer your questions. So we'll hang out here for a few minutes. We're coming up on the half hour, but we'll hang out for a while and answer any questions you may have. And while we're waiting for any questions, I will go ahead and mention again that as Jim had said, we can set you up on a 30-day trial. There doesn't cost you anything to give it a try. And you can give it, evaluate it and see if it works. You can cancel it with an email, and there'll be no fees. Okay, Jim. Well, I'm not seeing any questions coming up right now. So, thank you, everyone. I will get out an email, if not later today, by first thing Monday. I will get an email out to everybody with a copy of the video, and feel free to email us or give us a call with any questions that you may have. Thanks so much for all of your time this afternoon. We really appreciate it. Bye-bye now.